All right, we're back here with our On Politics panel talking about the proposed health care cuts to our state. Gentlemen, we have a little bit of time to have closing remarks, and I just wondered, looking at all these people that have been chatting with us today, where are we going to be in 5, 10 years, John?
I think unless there's fundamental change at the federal level in terms of repealing, replacing, or reforming Obamacare, the state is going to head toward bankruptcy of the Medicaid program, leading to much more dire consequences than what we are dealing with today with the uninsured. So I think the primary responsibility of our legislature and our congressional delegation is to continue to press for changes at the federal level to allow us to better manage our program to meet the needs of the demographics of this state. The federal government has no business dictating to the state how we ought to manage the program, and if we can make that fundamental change in 5 or 10 years, we'll be on the road to solvency as opposed to bankruptcy.
Bruce, it looks like if the GOP has its way here in Texas that these cuts will stand and no new taxes. How's that going to look in 5 to 10 years?
Well, it's unsustainable. But then again, the whole medical system in this country is unsustainable unless we do some serious reform. The concern I have is the reform that we're proposing, even on the national level, is not any reform that controls cost. So we have got to figure out a way to reform the system that adds cost controls as well as insurance reform. The federal legislation was simply insurance reform, and it's not sustainable with the current financial mechanism.
And Tim, what do you tell those patients that are facing whatever is coming?
Right. Well, that's the question. I'm an eternal optimist, and I think we can figure this out. I do think we're going to have some new revenue in the system, but we can use those dollars smarter. I think Dr. Malone mentioned one of the roles the nursing homes play is a transition for folks coming out of surgery or serious situations in hospitals, helping them through rehab and therapy to get back home. We can figure out ways for the providers to work better together, I think, to really focus on what is it this patient needs at this point, and how can we serve them most efficiently and economically.
And what do you tell doctors, Bruce?
Well, the doctors are worried. I mean, as you know, we went through a big reform situation last year, and the Texas Medical Association believes that we need to take this current bill and keep what's good and fix what's broken. We have a list of the things that are broken. One of the concerns we have is that right now there's good insurance reform, and people like that, but there's no cost control in the bill, and it reflects a $500 billion reduction in Medicare costs, and we just don't think that's going to happen.
Big decisions. We will keep tabs on it all. Thank you very much, gentlemen, for joining us this morning. And if you missed any of our discussion this morning, the video will be online later today. Just log on to KXAN.com. And while you're there, click on the On Politics tab at the top. You'll go straight to our special political site where you can check out our latest coverage, Session 11 episodes, blogs, and interact with us before next week's programs. And the results of this week's On Politics poll are in. We asked you, do you think voters should be required to present a voter ID at the polls? And 73% of you said yes. Well, beyond the ballot box, there's another way people can shape policy at the Capitol. Public hearings for bills can be crucial. Your chance to speak directly in front of lawmakers about the issues that matter the most. As the House sets its rules last week, it faced an amendment to bypass that public testimony when it eventually considers the voter ID bill. One member, Representative Warren Chisholm of Pampa, spoke up and said cutting the public out was a bad idea, especially with something as important as this. The House listened and shot that down. It's easy to think some lawmakers aren't hearing our pleas at times, but it's comforting to know at least some of them still want to. We'll see you next week. Thanks a lot.